My name is Jess Howard. I'm the site director for Middlesex Centre Family Medical Centre in Ilderton, Ontario. Ilderton is a small town that's located 10 minutes north of the city. We're part of the regional program. We have 4 clinical teams here. Myself, Dr. Van Dam, Dr. Leger, and Dr. Craig. And each of us teach 2 residents and usually a medical student at any one time. Dr. James Mather is also part of our practice, and he has residents and medical students as well. In Ilderton, our residents join us for 4 months in first year and 9 months in second year. During the 9 months, they do horizontal electives in lots of different things like women's health, emerge, whatever they feel they need to become practice ready. And with respect to other things that we do as a center, Dr. Van Dam has an interest in cognitive behavioral therapy. Dr. Leger does a lot of nursing home work, and Dr. Michael Craig has an interest in adolescent health and sexual health and works at the walk-in clinic downtown. And I have a skin disorders clinic where I run out of Ilderton, Exeter, and Petrolia. And I have a focused practice in dermatology as part of my full-time practice. We are a young practice. I'm the oldest physician in the group. I've been practicing for 7 years. And we have medical students with us all the time. So it's a fun practice. We have great staff here in Ilderton, and there's a lot of teaching opportunities for residents to teach medical students as well. We have daily teaching, either sort of bedside teaching or rounds. Fridays are our main day for teaching at lunchtime, and we also have our academic days on Wednesday mornings, which are resident-led, and also have the faculty present and or members of the interprofessional healthcare team.
I'm Tanya. I'm one of the second-year residents in the Ilderton Regional Program, and I'm under the supervision of Dr. Howard. So basically, I was transferred in from internal medicine. So I was halfway through my second year, and I transferred to family medicine, and I chose the regional program partly because of the ability to do both urban rotations, but also do a lot of rural, which gives me a lot more hands-on experience. What's nice about Ilderton is that there are a lot of young patients, so it's nice from my background to have more, I guess, exposure to prenatal care as well as well baby visits, and a lot of dermatology as well, which is something that was definitely not a forte in my background, so it's nice to have that as part of my practice here.
Hi, my name is Tommy Choi. I'm a PGY1 resident at the London Regional Program of Family Medicine at the Ilderton site. So far, I've been really enjoying my time at the Ilderton site. I've had a lot of hands-on exposure, whether through Dr. Howard's Skin Clinic or the Emerge shifts that I work with Dr. Van Dam. In addition, I really enjoy my experiences working in the retirement home with Dr. Leger once a week. There's a very wide variety of patients that I get to see here, and I really think that this is a great place for me to do my training, and I look forward to my practice when I'm done with the program here. So
initially when I transferred in, I was very, a little nervous to go from an inpatient setting to an outpatient setting, but the staff here are excellent. They're very, very friendly, and everyone's pretty young here, so it was a really easy transition that way. The nurses are very helpful, so for my first immunization or my first well baby visit, they'd be there to help me throughout. They kind of direct me in terms of how to get the things that I need or how to do referrals in an effective way, and who's the best person to kind of send things to get things done quickly. So the environment here is super friendly. People are very easygoing, and there's a lot of camaraderie that way. So it's a very enjoyable experience. It's kind of a pleasure to come to work on a daily basis. The patient population in Ilderton is quite diverse. We have patients that are anywhere from young families that are starting off with new babies and seeking prenatal care, preconceptional counseling, up until kind of the geriatric. So we have actually a lot of palliative care patients, and we just started doing home-based visits as well through the Ilderton program, which is excellent. So providing that care for our patients is an asset, and that's something that they feel great about and are very fortunate to have that option. So the diversity of patients is lovely. We also do some resident care in the retirement homes, so that we do once a week for 4 weeks, and we alternate monthly with that. So that's also another experience, having to go into people's retirement homes and providing care there. The breadth of family medicine at Ilderton is excellent because you have patients that are living in the country or coming in from the city, so you get quite a variety. And then we do have the exposure to both dermatology and emergency medicine, which is an asset in terms of acquiring the skills that you need once you get into practice. The Ilderton program is excellent. The call is very minimal, so you are on call quite often, but it's only for the residents or the patients that are patients of the clinic. So after hours services are mainly referring those patients onto you. We don't cover emergency rooms overnight. We don't cover nursing homes overnight, so there is less demand that way on call. However, the volume in clinic is very heavy in your second year. We're here for 8 to 9 months in your second year, which is a unique aspect of the Ilderton program. And you see patients at a much quicker pace, at 15 minutes per patient most of the time, or half an hour for physicals, which really gets you into the practice of being a full-fledged physician. So when you do graduate, you feel ready to take on that volume.
I think we're just a really fun center to work at. I think a lot of our residents just have a really enjoyable time working in Ilderton. We try to keep things casual and informal, yet have a good teaching curriculum, and I think residents really enjoy spending time here.